Okay, let's go. Let me find you. All right, hold on. Let's find Maris. Let's bring her in. Everybody still learning something tonight? Okay,
Yeah.
so Maris, it's all you.
I can't see it. I just see Jalen right now. Hold on.
Okay, does everybody else see my screen?
Okay, I can see it now.
Okay.
What is the most appropriate AEMT level treatment priority?
Okay.
It's a 2-step.
All right. Oh, this is a good one.
A 33-year-old male has vomiting and diarrhea for 2 days.
All right, stop right there. Vomiting for 2 days. What kind of what kind of acid-base problem could that lead to?
Metabolic alkalosis.
Okay, you're saying metabolic, which one?
Alkalosis.
Alkalosis. Okay, all right. And what about diarrhea for 2 days?
Metabolic acidosis.
Metabolic acidosis. Okay. And the way we remember that is which end is it coming out of? The diarrhea comes out of and then that's called acidosis. Okay, cool. All right, what else? Now, both of these, vomiting and diarrhea, can lead to what ultimately? Both of those are fluids, and when we lose too much fluids, that can lead to what?
Hypovolemic shock.
Hypovolemic shock. Is that going to be a oxygenation, ventilation, or perfusion problem?
Perfusion.
It's going to be a perfusion problem. So our treatment is aimed at restoring perfusion. So this was vomiting and diarrhea, but it's still a perfusion problem. All right, keep going.
He's weak and dizzy when standing.
Okay, that's not good. Okay, so
His
weak and
orthostatics
dizzy
are off.
with standing, that also could support some kind of orthostatic hypotension, where when he stands up, we don't have enough blood flow going to the brain. Okay, his pressure is, he is hypotensive, he is tachycardic, respiratory rate is, he is slightly tachypneic. What about his
Elevated.
oxygenation?
Normal.
Okay, tell me about his skin.
Cool.
Okay,
And lungs are clear.
lungs
So
are
I'd say
clear.
he's
That's
kind of
good.
shocky.
So this patient is some kind of shock situation. And so based on that, find me an answer that would make sense.
So start with D, place some supine and delay IV access until arrival. No, because you don't want to delay, and that's not addressing the perfusion problem.
Okay.
Restrict fluids because all shock patients may develop pulmonary edema. That's also incorrect.
No, now it can happen. And so that's why I need to be checking, I need to be checking breath sounds before and after fluids. But I don't base my decision to do breath sounds on fluids. I base my decision for breath sounds on if it's a patient with lungs, right?
Yeah, and here it states the patient's lungs are clear.
Okay.
Nitroglycerin for possible cardiac weakness. There's nothing that really indicates that, and his blood pressure is
with his
not
blood pressure, that would definitely
sufficient.
be contraindicated. So I'm only left with an IV crystalloid fluid bolus. What would be my fluid of choice in this situation?
I would do lactated ringers because he's borderline acidotic to start with.
It could be. Now, if in this case for straight hypovolemia, normal saline may be fine. It's just based on what you have available and based on your protocols. But we want some kind of isotonic crystalloid like ringers or saline. If I can use ringers, I may go with that, but saline would also be fine here for just strict hypovolemia. All right, let's go to the next one.